everybody, my name is Amy Pishner. I'm the owner and head trainer of Valor Canine Academy. I'm here with Dana O'Lone-Long. She is our trainer in Chattanooga, Tennessee. And Dana is out here right now with us. We just completed our very first weekend seminar here in Seattle. And Dana tagged along just so she could, spend some time with us. It's been about a year and a half since we were together, so it's been really nice getting to spend some time with you, reconnect, and kind of go over, the training that we've been doing and making sure that we're on the same page with everything, because it's really important to keep that consistency there as a company. But we want to use this as an opportunity just to talk to you and kind of let people get to know you better. I tend to post a lot on social media. It's something I've become more comfortable with. Dana doesn't post as much, but she should be. She's extremely passionate, she's extremely knowledgeable, and you're just all around a very cool person. So I want people to get to know you better. Okay. So I've got a series of questions here just so we can kind of dig and get to know her a little bit better. So Dana's been with Valor since September of 2015. And she is, our trainer for the Chattanooga location right now. She is our only trainer, so you have a huge workload out there. Super busy training dogs. But let's go a little bit back in time. Before Valor Canine Academy, you were a vet tech.
Yes.
Tell us a little bit about that.
Well, when I was my entire life, dogs, cats, they've been my passion. That's what I've always enjoyed working with. And so as soon as I was old enough to go have a job at an animal hospital, I did. I worked at a regular clinic and helped out with just regular health type stuff, and eventually moved to Chattanooga, where I worked at an emergency and specialty clinic and had some amazing opportunities to work with some fantastic doctors, all sorts of different medical cases, everything from your emergencies to internal medicine specialty, some very interesting surgeries, procedures, all that. That's actually where we met originally because of that. But that at the time was my way of helping people with their animals. Everybody kind of has their preference on the types of dogs and things like that. So I had a lot of opportunities to
a lot of hands-on.
To learn about different behavior types. You obviously approach things a little bit differently in a veterinary scenario. But it's been pretty much invaluable as far as my abilities to read animals, work with animals, dogs obviously specifically, that may not be super keen on what you have in mind for them.
A lot of dogs don't want to be at the vet. They're not comfortable at the vet. So your handling skills really developed while you were there. You had to learn how to work with these aggressive or fearful dogs who were in there for surgeries and not get bit.
Right, exactly. You know ultimately what's best for them, and you want to go about it in a way that's going to be best for everybody involved and safest for not only yourself but for the animal as well. And so you do. It's kind of a sink or swim sort of thing. You better figure it out, and you have to be good at reading animals, reading their body language, understanding when to back off, when you need to, press forward. And
I'll bet when owners are bringing their dogs in an emergency situation, they're super fun.
You do have to have a lot of pretty good people skills eventually. Like you don't get in that field and say you don't do it because you don't like people. You're going to be in big trouble because you have to be able to communicate in a very emotional, stressful time for them, and you need to be able to.
You learn how to be the center, the calm in the middle of the storm, which is exactly the same as rehabbing dogs. You need to learn how to communicate what's going on with the dog to the owner, and find a resolution to that issue, that problem solving. Is there a particular patient that you still remember? A certain dog where either you loved the dog or the dog was especially challenging, or is there just any dog that stands out to you?
There's probably a couple, and at this point, it's been so many years since I spent full-time, working in an animal hospital.
You were there for 15 years?
Not at River for 15 years total. I was a technician for about 15 years in a number of different clinics, but my longest span was at River and at the emergency animal hospital, and I worked specifically with our internal medicine department. So probably the patients that we became the most attached to, some of our patients we were treating on an oncology basis. So these animals had cancer of some sort, and we were seeing them literally a lot of times minimal once a week, and so you did become very attached to them. You start to know the owners a lot, and to be able to, I guess, offer for people that kind of opportunity to, a lot of people assume cancer in animals, there's nothing you can do, and that's not the truth at all. So the people are very, very grateful for
Oh yeah.
what you can offer
You
them
guys
in
are
that time.
their last hope.
Yep.
That's awesome. You know, it's extremely rare to have a dog trainer who has an extensive medical background. You know, usually the joke in dog training is that veterinarians or those in the medical field for pets know about as much about dog training as we know about veterinary medicine.
Right.
But, you know, we're really lucky with you because you have that 15 years of knowledge, you know, going into it as a dog trainer, and that's just, you know, invaluable.
Yeah.
And I know your clients feel really good being, you know, sending their dogs to you, knowing that if anything were to go wrong, if their dog were to get sick, you can, you know, diagnose that in a way, like looking at the signs and symptoms.
Yeah, be able to kind of tell what's an emergency, what needs to be treated by a professional immediately,
and that can be
that sort of
life-saving.
thing. Yeah, absolutely.
You know, a lot of people don't understand that, so that's really, really cool. So moving on, why did you decide that you wanted to leave the medical field and pursue dog training?
As much as I loved what I was able to do as a technician, I was really kind of starting to, I guess, approach a point in my life where I felt like something needed to change. You know, you can only stay static for so long. Obviously, things are always kind of in flux to an extent. And I really just kind of felt like it was time for something to change. I kind of looked into a couple different avenues to say, you know, what might I there are other things, not as much that I enjoy as much as dogs. And so I really was kind of checking things out, and it was just also a very interesting time because mentally, I was spending a lot of time trying to figure out what is it I'm supposed to be doing right now. And then
what's my life
came in with
purpose?
Duke, and it was a really every once in a while, like times come along in life where you're like, and there's your sign.
So my German Shepherd got bloat. Because of the little bit of experience I had from first aid and canine CPR workshops, I recognized the signs and symptoms, you know, in under a minute, and was able to rush him into emergency medicine.
Yeah.
At the time, I had recently adopted him, and he was still kind of a rehab case, where if you start poking and prodding, he's not going to be a super happy camper. Add to that he's in a lot of physical pain. So Dana actually opted or volunteered to swap clients from the dog she had with somebody else who had Duke. And so she was his caretaker. I came in to check on him and see how he was doing, and got talking to Dana. And she was like, "You're a dog trainer, you know, let's talk about that." Months later, she came in and started doing, maybe it wasn't even months later,
Yeah, it was a little while later.
Yeah.
We actually trained a little bit together.
Yep, did a consultation, did a lesson with her dog, joined a group class, got her CGC with Charlie. And then after I left Tennessee, she contacted me. I was like, "Hey, you know, would you be open to training me? I want to be a dog trainer."
Board and train.
Yeah, will you do a human board and train with me? Will you teach me? You know, I think this is what I really want to do. And, you know, it just kind of took off from there because I already met her, you know, knew that she was a very passionate, hardworking person. You were early to your lessons. You soaked it all up. You were really interested in that. Your dog loved you.
Yeah.
You know, just to see that relationship that you had, you know, there was something special about you. So Dana was the first person I ever trained to become a dog trainer. She came out to Washington for a month. We worked together. Those are probably 80, 90-hour weeks.
Yeah, we were busy.
Very busy. And then she basically picked up where I left off in Tennessee. And that's, you know, that's a huge undertaking to go back and you know, just jump right in, you know, head first type thing. And you've done phenomenally out there.
Thank you. I've really, really enjoyed it. It is a lot of work, and it is kind of like figure it out sort of thing. And, you know, the parts that are not just the dog training factor, but it's been such an amazing opportunity that I've really spent a lot of time kind of wondering, like, is this a trick? Is this really as good as it is?
Is this your life?
Exactly.
So tell us, Dana, what does a typical day look like for you as a dog trainer?
So every day is a little bit different because of the way I structure my private lessons and things, but typically, you know, I have 3 personal dogs. So obviously they're always there, and then at any given time there's usually 2 board and trains and maybe 1 or 2 dogs that also, you know, client dogs that will board.
And you say there, but this isn't a facility.
In my home. So literally in our home. It was originally supposed to be the man cave of the house. And,
it got taken
over by the dogs. But it is actually.
You're married.
Yes.
Married husband, no kids, not yet.
No 2-legged kids. But it is the downstairs, you know, like a family room for our house that we have. We're very fortunate to have such a nice opportunity. You know, it's not quite the same size as obviously your training space out in Spokane, but a good place where the dogs are literally my board and trains, the dogs that come and stay with me when their owners are traveling or whatever, they literally live in our home with us.
Awesome.
You know,
Yeah,
they're
it's
very
huge.
much a part of our daily routine, our daily life. So,
Yep.
you know, obviously taking care of them and
Yep.
getting started with some short sessions in the morning.
Yep.
And then as far as, you know, private lessons and things, I usually do a couple of those back to back. I'm very fortunate to have a training space inside Nougapause in Chattanooga. So on the North Shore, I've got some space in there. It's a fantastic shopping area that we can use.
Yep.
Minimal distractions where it's appropriate, and then just about every
Maximum
distraction we could
distractions.
possibly need
Yep.
for training. Everything from, you
Very
know,
cool.
the different shops that are around and things like that. So
So you
it's kind of
start
going
with a
back
little
and
bit
forth.
of taking care of your dogs and
Mhm.
working with the board and trains, and then doing private lessons. And is that like morning and afternoon, kind of throughout
Correct.
the day?
Yes. So I usually will do maybe 2 to 3 lessons back to back in the morning time. I try to be very flexible for people as far as scheduling is concerned. For, you know, if evening times are best, then I offer evening times during the week. Tuesday evenings right now are when my group classes are, so I hold those classes at the White Oak Park and Red Bank. We've got a really nice pavilion set up there. So between Nougapause and the park, and I do also offer, just like you guys, the in-home lessons as well, so I can
Go to you.
go to them, and it really, the schedule changes from day to day to, you know, wherever I need to be for in-home lessons and things, but I try to keep those chunks of time relatively short so that I'm coming back and forth into my house to take care of the board and trains
Yeah.
and things like that.
A
So
lot of back and forth, a
Yep.
lot of here. Every,
Yep.
every minute is delegated to do
Yes.
something.
Yep,
Yeah, so it's very easy to be very busy.
it
as a
is.
dog
And
trainer.
then all of a sudden it's 8:30 at night and I'm like, oh,
Have I
I need to
eaten
eat
yet
dinner.
today?
Yep, and I can't complain about that. I don't know many other jobs that I